Now we will be reading about internal resorption. First, resorption is defined as a condition associated with either a physiologic or pathologic process resulting in loss of dentine, cementum or bone. It can be physiologic or pathologic. Physiologic means it occurs due to aging, or pathologic means it may occur due to caries or trauma. Resorption may occur due to either of aging or due to caries or trauma. It occurs from inside to the outside structure of the tooth, that it begins from dentine to the further structure. Like we can say that it starts from the dentine of the tooth structure, like either the coronal dentine or the radicular dentine. Dentine, or it may progress towards the enamel or towards the cementum in the radicular portion of the tooth. Now, internal resorption is an idiopathic, slow or fast progressive resorptive process occurring in the dentine of the pulp chamber or in the root canals of the tooth. It is a idiopathic, like of unknown origin. We don't know the origin of the internal resorption of a tooth. It is occurring in the dentine of the coronal portion of the tooth or the radicular portion of the tooth, that is the root canal of the tooth. Etiology of the internal resorption is unknown, or it may occur due to the trauma. Symptoms appear as asymptomatic. Most of the time, internal resorption does not give any symptom, and sometimes it appears as pink spot when the resorption reaches to the coronal portion of the crown. When it is in the dentine or in the root canal, it doesn't give any symptoms. Once it reaches to the coronal portion of the tooth, it appears as pink spot, and the diagnosis is confirmed as routine radiography, and it appears as round or ovoid radiolucent area. It may appears as round or ovoid radiolucent area in the radiograph. Like when it is present in the radicular portion, it will appear as a radiolucent area, and it is also appear as a radiolucent area when it is present in the coronal portion of the dentine. Radiolucent area in the routine radiograph, and it is clinically visible as pink spot in the coronal portion of the tooth. Treatment of the internal resorption is the extirpation of the pulp. Like we have to remove the pulp in order to maintain the tooth in the arch. Root canal treatment is done using plasticized gutta-percha, and once internal resorption perforates the cementum of the tooth, we require the preservation of the tooth structure by using MTA.